Welcome to the 4th Annual Bio El Paso-Juárez Summit, MedTech Manufacturing on the U.S.-Mexico border, building a resilient binational industry. And we're super excited to have our sponsors, RexMed, who helped us make this event possible. My name is Emma Schwartz, and I'm the president of the MCA Foundation and CEO of Bio El Paso-Juárez. Bio El Paso-Juárez was launched exactly 3 years ago. And in these last 3 years, our organization has been dedicated to supporting the region's medical device manufacturing industry. Our mission is to drive innovation, collaboration, growth, and resilience in the regional medical device sector by bringing together medical, industrial, academic, governmental, and entrepreneurial leadership. Bio El Paso-Juárez's annual summits are dedicated to the medtech industry in El Paso and Juarez, which have proven to be an essential part of the global supply chain for medical devices and a hub for U.S.-bound medical device production. We have 4 distinct panels on the agenda today that focus on various pressing or emerging issues in the medtech industry and in our region as well. In addition to focusing on innovation and acceleration, we will be discussing technology adoption in the medical device manufacturing, as well as supply chain and sourcing on the U.S.-Mexico border. I hope you'll take the time to join us throughout the day and then come out if you're actually from this region and join us at 5 o'clock p.m. at a reception in Juarez at CITA, the new Innovation Center. But this morning, I'm thrilled to welcome you to our opening panel, which will focus on the COVID-19 response, the impact to binational manufacturing and lessons learned. I invite you to utilize the chat box during this morning's session, and we will try to get to the audience Q&A later in the session. But before I welcome our esteemed panelists, I'd like to take you back to March of 2020, right around March 15th, when the world began shutting down all around us. Here in El Paso and Juarez, we were immediately faced with the challenges from dealing with 2 countries, 3 states, and different municipalities and counties, all grappling with shutdown policies and procedures. We were also dealing with massive shortfalls of PPE and ventilators, all while trying to understand the distinct and pressing needs of both El Paso and Juarez. It was a chaotic and difficult time for all of us. At Bio El Paso-Juárez, we began meeting with the medical device manufacturers in El Paso and Juarez 2 times a week to understand their capabilities to produce PPE, to increase their production, or to pivot to PPE production, what their operational challenges were, and how we were going to help them stay open during pandemic closures. We learned that many of our region's manufacturers were not only working to control the spread of COVID-19 in their facilities, but they were operating at maximum capacity to meet the global medical device demand. As the pandemic carried on, our needs shifted to sharing information and collaboration, testing supplies and services, and vaccinations. Although El Paso Juárez is one binational community, COVID-19 presented a real and longstanding challenges to combating a pandemic between our borders. It also represented an acceleration in learning and relationship development. Here to share with us more on these bilateral challenges and lessons learned, I'd like to welcome our first speaker, Dr. Julia Marinissen.
Good morning, Emma. How are you? Thank you so much for having me.
Yes, I'm going to read a little bit of your bio. Your bio is quite extensive. I've cut it down because I know what they want to hear from you. But Dr. Marinissen is a health attache to the U.S. Embassy in Mexico City, representing the Office of Secretary of U.S. Department of Health and Human Services, and serving as chief of party for HHS offices operating in Mexico. She leads and promotes bilateral engagement and collaboration on scientific biomedical research, public health, health systems, health security, and border health. She also serves as the newly appointed acting executive director for the U.S. section of the U.S.-Mexico Border Health Commission. Prior to these roles, she served for more than a decade as the director of the Division of International Health Security in the Office of the Assistant Secretary for Preparedness and Response in HHS. She represented HHS in multiple White House National Security Council policy coordination committees on global health security, and was a founder and chaired the North American Health Security Working Group. Dr. Marinissen, you are a perfect person to come and enlighten us on what went on during COVID and what did we learn?
Thank you. Thank you so much, Emma. And I know, just want to make sure that you can hear me okay? Okay, perfect. Really, years of collaborating with Mexico and also Canada on health security We have more than a decade, at least as far as I've been engaged, more than 15 years working with Mexico, preparing to respond to public health emergencies. We actually started to work together in 2006, and when 2009 pandemic influenza happened, we were able to activate immediately trilateral collaboration mechanisms. And back then, after the H1N1 lessons learned, where coincidentally we suffer from things very similar to what we are seeing now with COVID, we realized that the only way to respond to emergencies was at a very minimum at a regional level, and of course globally. But we understood early on how interconnected our countries were in North America. So right after 2009 influenza, we launched the North American Plan for Animal and Pandemic Influenza, with the hope that it's called the NAPAPI, North American Plan for Animal and Pandemic Influenza, with the hope that plan, that was a collaboration in between the health sector, the agriculture sector, the security sector, and the foreign affairs departments to attend the foreign policy issues, was the way forward. Obviously, in the last 10 years, we worked a lot. Much of the focus, believe it or not, was on medical countermeasure sharing, how we deploy vaccines and medicines across borders. A big part of the focus was also on sample sharing. If we have an outbreak on one side of the border, how do we ship samples to the other side of the border? Believe it or not, there's enormous amount of complications related to that. We could have an entire conversation about sample sharing. So in reality, I just want to make sure you hear me okay. My speakers are making some noises here. We have these enormous complications, as I said. Other areas of focus were on emergency communications, to make sure we have mechanisms to talk to one another. And a big area of focus was the need for protocols for joint outbreak investigation to understand where we were at a given point in a disease outbreak. And then we were thinking about interoperable real-time surveillance systems in a way that we could have immediate understanding of what the situation was. Those things were much more complex than we anticipated when we put it in writing in 2012 in the first plan. And one of the big challenges, obviously, was to work through all the political changes in the three countries, obviously. However, we did have a technical working group that was driving all this work. And luckily, when COVID started, we were immediately to convene trilaterally the three countries, the four sectors that I mentioned, and start working right away on COVID matters. And the NAPAPI became the sole mechanism to have visibility on what the countries were doing. On a variety of topics. At the very beginning, on outbreak investigation, on modeling. Remember the first year of the pandemic when we didn't know where this was going and we needed to share models. Another huge issue was how to do surveillance for this, what mechanisms the different countries were using. Huge topic was the issue of diagnostics. Remember back then we have these number of serological tests, we call the rapid tests back then, and make sure that people understood that they were not really good for certain things. It was a huge issue what we needed to share information on. A big gap that we have is that the NAPAPI had a senior coordinating body of assistant secretaries, 12 assistant secretaries in total from the three countries that were supposed to coordinate policies. We had a technical group that was supposed to look at the technical problems and elevate recommendations for policy. And that, without getting into politics, is something that we lack in the last or the first 2 years of the pandemic. Luckily, those things are changing, and hopefully we're in a new direction. But one of the first meeting of the NAPAPI actually was, which I think is relevant to this group, is the issue of supply chains. Immediately after the pandemic started, we encountered the issue of lack of access to diagnostic tests or kits in Mexico. They were using the same platforms for detections that we were using, and because of the Defense Production Act and the needs actually in the United States, the production was staying mostly in the United States with very limited amounts going abroad. And it was very challenging. There was a lot of criticism of Mexico for not testing more, but apart from some policy decisions, the reality is that in the first months, there was an incredible shortage of test kits. And one more time, we were missing that high-level body that could look at that balance in between national security and helping or assisting our two neighbors for humanitarian reasons, of course, but also to be able to know what the situation in our neighbor countries was. I mean, without diagnostics, they couldn't have data, and we didn't know exactly what was going on. So that was the first shock of the supply chain issue, access to test kits. Absolutely challenging. Another huge issue that we encountered later on, and as you mentioned this, Emma, was the issue of access to ventilators. There was a huge demand. Ventilators were in a similar situation to the test kits. They were in our market. We have a huge need, obviously, in the country, but there was a lot of concerns about the capability of the Mexican system, the Mexican health system, to be able to treat patients and have access to ventilators. So there was a direct request from the Mexican president to then President Trump to have access to the U.S. market for ventilators. So Mexico was never asking for donations. They were asking for access to our market, okay? And that was a very challenging issue because it was not an official posture in general toward that, or special considerations for Mexico as a key partner of the United States. So we started with this issue of Mexico buying ventilators. They were allowed to buy a certain amount of ventilators, 1,000 ventilators in our own market, or from the companies that were providing our government. And it was, I had to say, I was in charge of making sure the ventilators got to Mexico. I would define it as a real nightmare. My boss here at the embassy used to say, I didn't think that you could make it happen because it was extremely challenging. Once the ventilators were, we allow Mexico to buy, there were a number of challenges with the specifications of the ventilators that Mexico needed that were not necessarily the one that we were offering. Then they needed to step up the regulatory processes to make sure those ventilators could come. Then they needed to train their personnel with those specific ventilators that were not necessarily the one that they wanted or knew how to use. So the complications started there. When finally the ventilators started to come in, the company started to have a lot of issues with the supplies that were coming from other parts of the world, as you can imagine. So they did not have enough supply to manufacture the ventilators that were promised. So it wasn't just a matter of supply chain in between the two countries. It was a matter of supplies that were coming from other parts of the world to put together the pieces of the ventilators coming to Mexico. So very huge challenge. Not to mention the PPE issue. I know my colleague Elvin, that used to be at the border in our consular office, will talk a little bit more. PPE was huge, and it was, again, the same issue. They did have they have manufacturing of PPE in Mexico, but very early before this got out of proportion, WHO warned us in a trilateral call that they knew a lot of the 80% of the production of PPE from Mexico was already being exported, and the government didn't have knowledge about that. So it took them a while to figure, okay, what do we have and where and who's producing? So that was a huge, huge issue. Then, obviously, when the companies producing PPE or manufacturing PPE in Mexico did not have enough capacity, we went back to the request to the United States to allow export. And here again, we were in a huge need for PPE and couldn't really help Mexico. So we were exploring all kind of options, and that's where I collaborated very closely with Elvin, thanks to his leadership. We were looking at Mexico bringing to the U.S. their PPE, some of the used PPE, to use some of the machines that we had on our side to sterilize and reuse the PPE. And it ended up not happening for a different variety of reasons. But even if we all wanted to make that happen, the amount of challenges to cross products across the border was incredible. So it was, from the regulatory point of view, not just the logistics, but from the regulatory point of view, it was huge. So that once again pointed to the issue of the need for regulatory harmonization when we think about supply chain and moving things across the border. It's not just a matter of having access to the products. It's a matter as well of having the logistic plans in place that go hand on hand with the regulatory aspects. You cannot cross a product that is not authorized from one country to the other if it's not authorized in the donor country, let's say, or the country where it's manufactured, or in the country where it's going to be used. So that's incredible. Sometimes the products were there, but they couldn't be used here because there was no regulatory approval. And if there's no regulatory approval, you don't have custom approval. So that was a nightmare. And there were many instances where the governors at the state level would say, well, we approve, we want the product coming from the United States. And from the federal level, say, no, you can't do that. The federal level has to approve that, the import of those products in the case of Mexico, under the approval of COFEPRIS. So we found a huge challenge in terms of regulatory approval of products coming to Mexico. And in many cases, the governors thinking that they could authorize products being imported into Mexico that didn't have license here or emergency use authorization or you name it. That was huge as well. So diagnostics, PPE, ventilators. And then obviously we got into the issue of the vaccines. I don't think I have a lot more time. So just to finish, I want to talk a little bit about the vaccines. Mexico moved really quickly to put contracts in place. So October 12th, I believe it was, of last year, they signed contracts with several pharmaceutical companies, even at risk, not knowing what vaccine will make it through the pipeline. But unfortunately, the companies had a lot of issues, as you know, with the delivery or the shipment to other countries. One more time, we bought, a lot, if not all, of the manufacturing capacity in many cases. So Mexico had a huge issue accessing vaccines, at least in parallel to the access in the United States, which something that the president here in Mexico was very keen on, make sure the vaccines were rolling out in Mexico were at the same time that in the United States, especially considering the challenges at the border. So we've been working together. It's been one of the most challenging things. We've been working together on vaccine donations. We have given Mexico nearly 11 million doses and hopefully some more coming. Nearly 10% of the vaccines they have administered have come from the United States as a donations from our government. But again, it's a huge challenge because in many cases, the vaccines that we use did not have regulatory approval in Mexico, so you had to start from scratch, and that's extremely, extremely challenging. So going forward, we need to, and hopefully, so you probably have seen in the news today that next week, I'm glad the timing of this meeting worked perfectly well because President Biden, President López Obrador, and the Prime Minister of Canada are meeting for the first time next Thursday. I think it's on the 18th. It's the first trilateral meeting since 2016. So that gives you an idea of where we were in that high-level political dialogue to harmonize policies and response policies in these cases. So the North American Leaders Summit is happening next week. And definitely a third of the agenda is going to be COVID and health security in North America. And definitely supply chain and how to address supply chain issues is going to be high up on the agenda. I cannot say a lot more. You will have to wait for the communique and for the meeting to happen. But yes, I can tell you because we've been working for a long, long time in this political commitment to put a lot of focus on North America pandemic supply chain and see how we get there. First of all, we had a lot of challenges during COVID to map where the products that we needed were in our 3 countries, whether the production was done here in North America or we were getting products from other countries. Our country and Mexico, I'm not sure how Canada did it. I'm sorry, but we launched, surveys through our embassies to understand manufacturing capacity in the world, to see where the potential markets were. But that's something that we don't want to have to go through again. We want to understand on the medical side of the supply, where we are, what we need, what the requirements will be, and then who can do that and who can supply that and in what timeline. So that's a process that we've been working on for quite some time, but now is when we finally have the high-level political support from the leaders of the 3 countries to say, okay, go do it. So I'm going to stop there. I know, Emma, you wanted me to talk a little bit about the World Health Commission, which is another key initiative that, a couple of months ago I started to lead, where we really need to, or are trying to bring together a better understanding of the local needs and the local capacity so there can be a better dialogue with the federal levels in both countries. So the Board of Health Commissions has representatives from the state level, 4 states on the US side, 6 states in the Mexican border, and the commissioners are the 2 secretaries of health. So we are in the new process of re-strengthening the commission. You will hear more hopefully soon, and then really, really use all the local expertise to make recommendations to leadership and say, this is what is going on at the border, this is what we need to do, and make sure that we create those communication channels, first of all, in between the local communities and the state governments, across our 4 states, across the border, and then with the federal level, which is a huge, huge challenge. As I say, there hasn't been a NALS, North American Leaders Summit, since 2016. So you can see that the trilateral communications were not there or not at the level it should be. And that in a way trickles down. A lot of communication happens at the local level, then that doesn't trickle up. So that's where we're hoping to put a lot with this renewed engagement at the leadership level, where we hope to go back to talk at all the levels that we need. Supply chains is a very complex issue, but without the marching order to address the huge challenges, we couldn't do much. So here is where we get started now, again, from scratch, basically, but with a lot of lessons learned from COVID. So happy to, I think we're already at time, so I'll stop there.
Great. Thank you so much, Dr. Marinissen. I have to tell you that with your background, I think what a tremendous opportunity for you to serve in the roles that you served during this unprecedented pandemic. And just
definitely,
you are most certainly a leader in this space and what you've got to experience and learn. And it'll be fun to see the lessons and what we do to improve based on those lessons learned.
Yeah, it's extremely challenging. When I worked for 10 years on solving or addressing the legal, logistics, and regulatory barriers to ship assets across the border in emergencies. It took years of research. People either were saying that would never happen, either because of national security issue or because we will never overcome the legal issues. Think about liability. People were saying, why can't we move vaccine from the US states to the Mexican states? No, the vaccine belongs to the government. And why? Because it's an experimental drug. Someone has to be responsible for liability. And like that with a bunch of assets. So happy to talk more. It's a very complex issue, but hopefully now with the leaders' commitment, we can move forward.
Very new conversations to come. Absolutely. Well, thank you so much. We would now like to welcome Elvin John. We were very excited to get to know Elvin last March. He was with the U.S. Consulate Office in Juarez, and Elvin very quickly joined all of our Paso-Juárez COVID-19 response committee meetings. We were meeting twice a week for many, many months, and Elvin quickly became a friend and advocate for Paso-Juárez and the medical device manufacturing sector. Elvin, I'm going to read a little bit of your bio, again, very extensive, and again, we're proud to have you with us today. Elvin has been a Foreign Service Officer for over a decade and served locally in Ciudad Juarez from August 2019 to 2021. He previously served in Washington as a watch officer at the department's Operations Center, working for the Secretary. Prior to serving in Washington, he was the Deputy Director of the Middle East Partnership Initiative based in the Embassy in Kuwait. He managed economic grants for the department in 12 countries in the region, including Israel, Jordan, West Bank, and Gaza. Elvin also served as an economic officer in Bogota, Colombia, covering infrastructure, aviation, and macroeconomics. He started his career in 2010, serving in a consular office in Hyderabad, India. And prior to serving in the Foreign Office, he practiced law in Dallas, Texas, as a patent litigation attorney. He holds a J.D. from Texas A&M University and a Bachelor of Science in Economics from SMU. So Elvin, welcome, and please do share with us a little bit of your perspective on our region's kind of local binational COVID-19 response.
Fantastic. Thank you so much for the kind intro, Emma, and what an honor it is to share this virtual stage with Emma and Dr. Marinissen, both of whom have been instrumental from a national and local level in responding to COVID-19. A lot of you don't know what Emma and Dr. Marinissen have done. A lot of you don't know, but I'm just so honored to have worked with them for the past year and a half and to really affect the local community. So this morning, I want to do two things. One, I'm going to share two examples of our local response to COVID-19. And then second, what I'm going to do is talk about three things that we can do as a local community to respond to a crisis. So since we're talking about supply chains, I want to first start off with, let's go back to March as Emma started, when the world was kind of shutting down. Mexico and the US were shutting down so we could respond to the crisis. And it, it was declared a pandemic. Now, one of the major challenges during that time was the supply chain. PPE, as you know, there is a lot of PPE that is produced here locally in Ciudad Juarez and in Mexico in general. And Ciudad Juarez, especially having a medical cluster, it was quite a challenge that the state government and federal government decided to shut down production. So one of the big challenges that, as Emma mentioned, we were all in a task force together. One of the big challenges that we faced, number one, was how do we restart production of very important PPE, and not just PPE, but other supplies that both the United States and North America in general need to get back to fighting the pandemic. How do we do that? So the first thing that we found was that we needed to have credible response so that the state and federal governments understood that the reopening would be done in a orderly and health-focused fashion. Now, as you can imagine, during the pandemic and when there's a crisis going on, there's a lot of misinformation. There's a lack of credibility at many times. So it was important when we got together as a committee, as a COVID response committee, was to find out, how can we bring in a credible system and experts to come in and say, okay, this is how you can reopen and still keep your employees and keep the community safe. So I'm glad to say that we put our heads together and we brought in one of the top 5 consulting companies in the world who had been working with local communities, states, and of course they were working with the United States government itself on COVID response. And the wonderful thing was that this company was able to come in and really put in all of their resources, their doctors, epidemiologists, statisticians, supply chain experts, to come together, do an interview of the local community. And I do want to thank the local maquilas who volunteered to open up their doors so that the experts could come in and see. And at that time, because of the pandemic, they were actually did it virtually. If you can imagine, literally people walking around with video, iPads and other things, so that the consulting firms could understand how best to reopen safely. So it was an amazing turnaround time. In just 2.5 weeks, we were able to get into the maquilas virtually, understand the needs, and come up with a plan to reopen the economy. And what a wonderful thing it was, because having that credible process to reopen and then presenting it to more than 400 different companies, and then also presenting that to our local and state leaders. When we did that, we really got buy-in from everybody involved. And I want to thank our embassy and local consulate colleagues and ambassador and so many others who got together to really push and to really instill in the leaders who were doing things, rightfully so, to protect the community, but to also understand, for them to understand that we're putting together a plan that is going to reopen the economy safely. So that was the first time. So when we're dealing with a pandemic, supply chains are so important. We learned that, and keeping the supply chain open, it's a very common sense thing, but to keep it open safely was just as important. So the first thing, during a crisis, what we learned is getting buy-in from people, and then of course, having a credible team of experts to come in and based on science, based on the local expertise, to go into the maquilas, to understand how the production works here in the region, to then safely reopen. So that was one great example of how we were able to come together as a local community and figure out a local response on reopening the economy. The second example of a local response I want to talk about is related to supply chain, but also talking again about our health outcomes locally. One of the big issues that we saw is El Paso, thankfully, was one of the counties in the United States that had one of the highest rates of vaccinations in all of the United States. So really proud of our local community, especially MCA, others who were involved in that, in messaging, in really encouraging people to get vaccinated. So El Paso did a great job. They had the local community leaders, FEMA, others, fire department, everyone who worked on putting together the aspect of vaccination was great, because we were using up all of the vaccines. But then soon enough, we found, okay, well, there's only so many people. We've vaccinated everybody. Now we're having excess supply. How can we use the supply? And then and for those who have served in the local community, understand is El Paso is not by itself. El Paso and Juarez, it's one region, it's one community, and we all talk about that. And what I saw in response to COVID was that it is a fact. People do think about it as one community, and the community leaders from both cities came together, especially from El Paso and especially Bio EPJ and MCA and others came together to really think outside the box and say, hey, how can we vaccinate more of our border colleagues, just as we did in El Paso? So I'm proud to say that there were a lot of no's, in between, but it really took a huge effort, as Dr. Marinissen has mentioned. To put something together like that, it was such a huge effort, because, as she mentioned, it's an experimental drug at that stage when we were doing it. This was prior to full FDA approval, and actually this was Johnson & Johnson. So the Johnson & Johnson vaccine, it's under emergency authorization. It's owned by the U.S. government. How do we get it to Mexico? Obviously, we can't import it to Mexico. How do we do that? So it was a very, very complicated issue, but people like Cecilia Levine, Emma, others from El Paso, Juarez, and all together. And of course, all of those in the community came together. It took, you can't imagine, so many different levels of people, index, and others to come together, CBP, Border Patrol, all those to come together and come up with a plan to vaccinate people at the border. Now, I don't want to go through all the steps because it will take more than 15 minutes to describe all of that. But as you can imagine, it's something to be really proud of, because when you're going through a crisis, when you come together as a committee, what we realized is it's not going to be just one person that makes these decisions. It requires a community effort. Now, you definitely need community leaders, and we have wonderful leaders here in the border region, but you definitely need other leaders to come together and people to come together from the smallest level or the more ground level all the way up to the mayors and county judges and others who came together to say yes to a very complicated issue rather than saying no, it's not going to happen. So ultimately, we were able to bring people right up to the border and bring the vaccine right up to the border without violating any of the rules and regulations that are in place. And we were able to vaccinate more than 30,000 individuals. And that's just an amazing accomplishment that I'm proud of to be a small part of that. But really, credit goes to the community. It really goes to the community and everyone, all the volunteers. It was all done voluntarily. And of course, a lot of people had to raise money. And that's what people don't understand. Even during a donation, right, there is money involved because you still have to pay people. You got to pay for things. You need supplies. You need buses. You need syringes. You need tape. You need, you name it. You need a lot of different things to come together, even during a donation. And as anyone who's worked with a charity before understands that, things are not free, right? Things are not free, and it costs money. But can you imagine people, got together, they donated funds, and people got together to really affect the lives of those more than 30,000 individuals. So those are the two examples of how, from a pandemic perspective, people got together to fix not only a supply chain challenge, but a vaccination supply chain challenge as well. So two great examples of how communities can get together and really affect on a local level. Now, from those two examples, I want to talk about three things on how to respond to a crisis. Now, before I came to the region here in Ciudad Juarez, as Emma mentioned, I worked for the Operations Center in the State Department. And the Operations Center, along with the Crisis Management Service, what we do is we respond to crisis around the world, right? And so this brings me to my first point, which is the first thing we need to do as a local community to respond to crisis is prepare, practice, and plan. So if you want to flip it around, plan, prepare, and practice as much as possible. Now, when you're dealing with crisis management, when I was in DC, and this is one of the things that, the crisis happens every day, but sometimes you do have some lulls, right, where there's not a crisis that happening. So what do you do during that time? What we do is we plan, we prepare, and we practice. That's what we do. So you cannot wait for the crisis to happen to have some sort of playbook in play to respond to it. It's too late, right? It's too late. It's too late to build the airplane while you're already in the air, right? So that's why I think as a community, and that's one of the lessons that we learned from being in those committees is there needs to be more preparedness, and there needs to be more practice, and there needs to be more plans. And I'll give you a great example. Now, when the vaccines initially came to El Paso, we knew there'd be several months before vaccines actually came to Ciudad Juarez because of the border, and we knew Mexico was going to take a little bit longer. But we didn't just rest on our laurels thinking, okay, well, it's going to be here in a few months, so let's just kind of sit back. No. What we did is we planned, and we prepared and we practiced. We literally brought health experts from the border region and from the state. They visited what was happening in El Paso, and they came and they were able to practice and see actual vaccinations in practice happening. So what did that do? What that did is when they went back and when the vaccines actually came to Ciudad Juarez and to Chihuahua State, Ciudad Juarez had the highest percentage of vaccine distribution in all of Mexico. Now, that didn't happen by accident, all right? Normally what happens is, you have 85 to 90% rate. So for example, if the health authorities in Juarez will get 100 vaccines, because of various reasons, about 10 to 15 vaccines are going to go to waste because of whatever reason, right? Mainly because they don't have practice and they haven't planned and they haven't prepared. But because they were able to do that, they had the lowest percentage of wasted vaccines. Now that saves lives. I mean, that literally saves lives. So the first example is, or the first thing that as a local community we need to do is plan, prepare, and practice. Now, number two, what we need to do is simple. It sounds very commonsensical, but get together, right? Get together. Now, what does that mean? What that means is the more minds you throw at a problem, the better, right? Now, if I'm 100% sure about this, if we did not have these committees that the MCA Foundation, Emma, and others that started, and they had several, right? If those committees did not come together, I'm 100% sure that that many of the responses that we did have in the local community and the many lives that were saved would not have occurred. So what I mean by get together is, if you are a community leader, if you're a business leader, or you're in the local community and have an expertise in the area, you need to get together with other people. You can't do it alone, and you can't affect the whole community alone. So getting together, and there's a lot of barriers to that, and that's normal, right? As a community, when you get together, I mean, we're people, right? When there's people who come together, there's egos, there's ideas, there's all kinds of things, right? But if we can put down those barriers, right, as individuals and get together, and that's what I mean by get together is we put down our barriers, we put down our egos or whatever that's stopping us from getting together. If we can do that and get together with other like-minded experts and people who want to go all in to save a community, you really can achieve something great. And that's the examples that I gave you. Those are amazing achievements that happened because people got together. So the second thing as a community we need to do is get together. And lastly, what I want to get into, and my time is short, the last thing what I want to say is get to the yes. I want to repeat that, get to the yes. What I mean by that is sometimes the no's are just as important as the yeses. Now, when we got together, we threw a lot of ideas at the problem, right? And 90% of those ideas didn't work out. But from those 90% of ideas that didn't work out, we learned so much to get to the 10% of ideas that did work out, right? So get to the yes. Don't expect a yes, get to the yes. That process of getting to the yes is just as important as the answer, right? So we can't, as a committee, as a local community, as business leaders, whoever you are who's watching this today, you need to understand getting to the yes is just as important as the answer of yes itself. Sometimes you're going to have a lot of no's, right? But through those no's, you're going to learn so much that when you get to that yes, it's going to be so much easier to execute. So those are the three things I want to leave you with is number one, plan, prepare, and practice. Number two is get together. And number three is learn along the way as you get to the yes. So I want to stop there. I know we have questions that we want to get to. So I want to stop there and hand it back to Emma. as we continue the conference.
Great, awesome. Thank you so much, Elvin. God, it takes me back. We went through a lot, didn't we? The last year and a half. Holy cow. Yeah. Anyway, I feel like I've done my whole life because of what we've gone through. But Elvin, let me start, and hopefully we'll loop Dr. Marinissen in here too, and have kind of a conversation with all of us. But let me start with the no. I know that you and I worked on a project, and we had a really big no, and we learned a lot of lessons from that no. Can you briefly describe our decontamination project?
Yes, yes, and I think Dr. Marinissen kind of hinted at that, and you know, it goes along with the get together part and the no part. So the get together part was great because so let me start with the idea. The idea was, so El Paso got a donation from the U.S. government for a decontamination unit. Now that unit would be able to decontaminate one of the most important aspects of PPE, which is masks, right? So we had these N95 masks that everybody's using, nobody can get. Now these decontamination units would be able to clean up to 80,000 masks a day, which we were like, wow, this is amazing. Let's do it. We have it in El Paso. We're not using it to full capacity. So we come up with the idea, hey, why don't we just take the masks that are being used in Juarez, take it to El Paso, clean it, and send it back.
Send them back.
It sounds simple, right? It sounds so simple. And it was crazy because
they were in dire straits. They needed more N95 masks, whereas our supply had started flowing. They were in dire need. Dire need.
Like literally, I used to get calls at the consulate all the time. I know Emma, you did as well. As a community, we did as well. So we were thinking, this is a perfect solution. You know, it's just 5 miles. You know, it's just 5 miles. Let's take it over. But let me get back to the get together part. So we got together, and there were so many people had to be involved to get to an answer of, can we actually do this? Literally, if you can imagine, I had over 100 people on a conference call. Over 100 people on a conference call from FEMA, White House. Dr. Marinissen had like a whole bunch of people from COFEPRIS, from the Mexican government. We had our local community. We had the company that had the donation, El Paso leaders. I mean, we're talking CBP, Border Patrol. I mean, like everyone you can think of from a government level came to this conference. And what was amazing was everyone wanted to do it. Mm-hmm, everyone wanted to do it. You know, and then what happened? What happened was, you know, there were so many regulatory restrictions, and we got the ultimate answer was a no. But I'll tell you what that taught us is that, you know, we learned so much when we get together, right? We learned that, hey, if you want to import something, you got to go through COFEPRIS. You got to, you know, get everybody in the Mexican government involved. If you want to get a yes from the U.S. government, these are the people that need to get involved, right? And until we did it, for example, I had no idea at the time that the FDA has to get together with CBP in order to say, yeah, you can take that mask back to Mexico. I had no idea. And FEMA was like, well, hey, by the way, we have this specific, you know, regulation, this, you know, specific angle, and Dr. Marinissen knows you know, a lot about that stuff, and she was like, you know, informing me about so many of these things that we didn't know about, right? But until you get together and try to throw everything at a problem, you never learn. And I'll tell you this, I 100% believe that no led to the yes on the vaccination efforts. I 100% believe that, because we learned so much about the regulations, and we were able to, you know, overcome the hurdles, right? You can only overcome the hurdles, you know, until you know them, right? Or else you're just going to run right into it as a race, right? As a hurdle race, you're going to run right into the hurdle and you're going to fall, right? But because we went through that.
And the relationships we built through that process, right?
Absolutely. Those relationships that we built came in huge, when we had to get an answer of yes for the vaccine?
Dr. Marinissen, Elvin mentioned the role of community organizations. And you know, I know for the majority of the pandemic, I had a weekly COVID community call that had, you know, between usually about 20 to 30 different members of our community, from the governments to the nonprofits and the education institutions. And then we later started one that was half Juarez and half El Paso. And just each week, it was a different topic depending on what was happening in the pandemic. So as you were talking about the U.S.-Mexico Border Health Commission and reviving that and examining that, what do you all see as the role of integrating these community groups? Because they're on the ground and they have a lot of intel and a lot of programs and even a lot of funding, existing funding. So I don't think it would take a whole lot of additional funding to bring them into the conversation in a regular basis, because, you know, they're already supported in doing things, but could provide a great voice to our governments.
Exactly. No, thank you so much for that question, Emma. And I'll refer to what Elvin said. You know, one of your 3 advices was to meet and talk. I mean, it's fundamental. And that's the challenge, you know. Our border is huge. It's huge and it's fluid. And we have all kinds of issues, from trade and travel to health. And I can tell you from where I sit, the big challenge is to integrate the cultures. And when I say cultures, I don't mean the US and the Mexican culture alone. I mean, that's an issue too, obviously, but it's the culture of the different communities. You have the federal government, you have the state, you have the local, you have like the private sector, you have, you know, the civil society, and everyone sort of speak different languages. And since that communication doesn't happen at the level that it needs to happen to respond to an emergency, because the communication happens. I mean, things, you know, we're a great society no matter what, but when you are in an emergency, when you do the crisis management, those communications need to happen. And the big challenge for those communications to happen is when you don't have structures that survive political changes. In all those levels, okay, from the civil society all the way up to the federal government. So then you feel like you're reinventing the wheel. So one of the big challenges is to create structures that survive those political challenges. And I'm sorry to refer, you know, we try within APAPI, we say we're going to create this political body that can make decisions, and we're going to create this technical group that can survive despite those political challenges. And we were able to do it for 12 years, to the point down at the leaders meet, and we have the warm base ready to go. And so, and the same that we're trying to do with the Border Health Commission, you know, like make sure that there is that place where all these different sectors that we just mentioned can come and talk. The challenge is how to create a language for that communication. And again, despite the English and the Spanish here, you know, which is, I mean, Elvin, you were talking about that, but sometimes looking for the platforms that can build in translation, looking for the translator, looking for the contract translator. So that's just a little bit of then the language of the different groups that speak these things. As Elvin said on the call for the decontamination of PPE, 100 people, I should say, Elvin, everyone on board. I never seen, you know, like, okay, everyone on board we're going to do this. Everyone wanted. And then we couldn't make it happen because of all those little pieces that nobody, even within the federal government, is like, oh, we don't know who needs to do the export permit from FDA, and then the export permit from CBP. And then, you know, once we move this from one place to the other, who owns it? What is the liability? Who needs to, on the Mexican side, who regulates this? The state level regulatory authority or COFEPRIS at the national level? So, and then you start to go over all these things, and then sometimes the juice is not worth the squeeze. And the same is with all these levels trying to communicate. So you have the challenges like, okay, what are the most important topics and for which group? okay, I agree on the topic that you want to discuss. I agree on how do you bring the different leaders from the sectors to talk. And then how do you issue recommendations? The federal level works at a different pace and when a different language. Look at Elvin, Elvin, you were there. Emma, you're right at the border. You are responding to two different worlds in a way. So how do you explain sometimes that, well, as I talk to my colleagues in the Board of Health Commission, we need the one pager that will go to the secretary. We can't go that more than one page. And then you have the challenge of explaining something very complex in this succinct way for a decision maker that is involved in 3 other million things, including not only the whole domestic thing, but also the global. So it is, I think that the challenge is in two. Number one, create the space to meet, which is what Elvin said. Elvin, I love that. I mean, that should go into a leadership seminar as well. Create the space to meet, and then create the rules of engagement and find the common language to solve these complex problems that we have, especially with border. And as I said, you have transversal, you have cross-border, and then you have the briefing map on both sides, and then the bilateral policies at the federal level that need to be creating the umbrella for then the border region not to operate in a vacuum, because otherwise is when these connections start to happen or have been happening, to be real.
I wish we had another hour to continue this conversation, but let me plant this seed. One of the challenges I think we need to address is the same thing with sharing PPE and contaminated or not is information. And we have a health information exchange that we've created on the US side. And we've talked about how there was such a lack of shared data on cases and numbers and everything. And so for one of our next working groups, creating a space to communicate and resolve how could we share data more effectively across the border for public health and medical purposes.
Oh, we're working on that, Emma, as we speak.
Okay.
The bilateral conversations are happening.
Well, we would be
Definitely.
love to be involved in that conversation.
Fantastic. It's coming. And it's coming, and it's being an important topic at the binational level, at the federal level, and the Board of Health Commission. So either you invite us or we invite you, but we'll be definitely talking about this.
Great. Well, Emily Hartman is the executive director of our Health Information Exchange, and I'll make sure to connect you guys. So anyway, thank you both, Dr. Marinissen and Elvin, for your contributions to our conversation this morning and for all the work you did to support us during the pandemic and all the work that I'm sure you will be engaged in with us in the future. It's really been a pleasure meeting you all and working with you. And this concludes our first panel of the day. I want to make sure to invite everybody to our upcoming panels that we have at 10:30 a.m. We have a panel on creating sustainable supply chains on the US-Mexico border. At noon, we have a panel on digital transformation of the medical device manufacturing industry, industrial applications of immersive technologies in highly regulated industries. And at 1:30, the future of medtech, innovation and acceleration. And so we've programmed in a couple of breaks between the panels so that you can refresh your coffee, stretch your legs, and get fully engaged. So we'll take a little break right now and then see you back here at 10:30. Once again, I want to thank our sponsors, RexMed Health, Workforce Solutions Borderplex, VWR, and CFAT. Thank you, and we'll see you all in just a little bit.